Welcome to the Misconceptions podcast. It's a podcast about leading a healthy life and a more mindful life. I'm very glad here to have with me today Stefanie Hookway, who is an NHS certified nurse with an interest in palliative care. Hi, Steffi. How are you doing?
Hi, I'm good. Thanks. How are you?
I'm doing good.
Good.
So, could you talk to us a bit about what it is to be a nurse? What does it entail, the hours, and all that?
So it varies quite a lot depending on what you do, as in what kind of ward you're on. If you're on a surgical ward, you do 12-hour shifts on any ward, days and nights, all jumbled, different every week. It just depends on how nice your sister is that does your off duty, but most of the time it's okay. And so for surgical wards, you'll have patients, because I've worked on a surgical ward, I've worked on an oncology and HIV ward, and I've now started a job in palliative care, which isn't a ward. But so on a surgical ward, you'll have patients going for theatres. We had kind of 2 short stay bays and 2 long stay bays. So some patients are quite heavy. They've got a lot of wounds. They've got a lot of that kind of care. Other ones are just going to get their appendix out and then they go home the next day. So it depends. Then you have medical wards where it's a lot of elderly. It's a lot more kind of personal care, washing, helping them to the toilet, helping feed them if they need, helping more with the social kind of stuff. If they want to go home, you work with the occupational therapist to make sure their setup is good when they go back home. But then if you work in outpatients, that's 9 to 5. And I've never worked in outpatients, so kind of guessing. But it's 9 to 5, and I don't think it's as much personal care because they're obviously patients that are able to travel in and be living at home, so they're not so dependent. And that's where the hours differ as well. For some people, 12 hours just isn't.
So it's
I think for everyone, 12 hours is desirable. And there's community as well.
Okay, which
I've only ever done my first ever placement of uni. So that's my only experience of community. But again, it was 9 to 5. I think it might have changed now.
So I'm guessing like the outpatient and the community are more preferable.
I think community can be quite heavy as well, though, because they're housebound patients. They're patients that aren't able to go to a GP or a hospital. So they can be quite heavy as well, you know. Or sometimes it's just diabetic patients. You just help them with their insulin and then you go. It's like a 5-minute visit. Others, it's leg ulcers and it takes ages to do the dressings and I think it's more varied community in what you see.
And like, when do you decide this? At what part of like, you could go from the beginning
if you want. So in nursing, I'm sure it's the same. Sounding like I'm an old woman. I'm not. I wasn't that long ago that I was at uni. But you choose adult, child, mental health, learning disability, nursing, one of those kind of specialties. Just do that for the 3 years and you qualify so I did adult. I came out as an adult nurse, but it's up to you what kind of ward you want to go on to. So I preferred surgical wards, so I went for a surgical ward job. But you could do anything. You could go for community, but they advised us to do ward work first for a year because you'll get so many skills in that 1 year. And then you just decide from there. Then after that, I wanted to do something more with palliative care, so that's why I went to the HIV oncology ward. Because in my hospital they had a really good reputation for looking after end of life care patients, so I went there. And then from there, got the palliative care job. So I kind of worked my way through different wards to get to the specialty I wanted. So you just do it however you want, really.
Why do you... No, continue. End it.
So just, there's no... You don't... In university, you don't say, I want to do palliative care. And then you join lectures about that. It doesn't... It's not like that. We had one placement in final year that we could choose, and I did mine in a hospice, and I did my dissertation in palliative care, but that was the most kind of specialized it gets at uni.
I understand. And why did you choose palliative care?
Good question. I've always just really had an interest in it. When I was younger, it's probably going to sound a bit weird, but my dad's a priest, and I would go to him to the hospital when he would be seeing people and reading prayers for them and talking with their families. And I'd go to cemeteries with him when he would be doing. It was just. I know it sounds a bit weird. Anyway, I really liked. I saw how much he helped the families. When my grandma was ill when I was younger, we had a carer who was awful. You know, you could tell she didn't really want to be there. She just kind of did what she had to do and left. There was no real compassion. And then, so my mum and her siblings got another carer, and she was amazing, and we're still family friends with her now. My grandma died like 10 years ago. And I just thought, I just thought, wow, she's amazing, how much she's made a difference to us as a family as well. You know, we felt in such a sad time more comfortable, happier, spending more quality time because you knew someone else was doing the hard bits and doing it well. And I think those combined, going around with my dad and seeing that kind of personally, I just thought, oh, I'd love to be able to do that for people.
I don't think that's weird at all. It's a genuine passion, I think.
Yeah. People always say to me, you're so young, isn't it so depressing? But I don't think so.
That's something I want to ask you. Like, have you found at any point that maybe your patient dies, the patient that you're taking after, how does that affect you?
It is sad. The thing is, you're not kind of sat because you're very busy. You do what you stay with them as long as you can. You make sure they're comfortable. You make sure someone is with them as much as you can, whether that's their relatives, friends, yourself, a healthcare assistant, so that they're never alone. So if they do die, they weren't on their own. But you're not kind of spending your 12-hour shift sitting there and woe is me. And
but I'm guessing you do build a connection with that person. And once he or she's gone, that's
it. Yeah, it is sad. It is sad. But also there's that kind of patient and healthcare relationship that you don't get so personal. Of course it's sad and of course, you know, you've built a connection with them, but you've done your best to make them comfortable, to make sure their wishes were met. And it's normal. We're all going to die. You know, it's sorry.
That's the truth.
Yeah. You do what you can to make it the best death for them, to make sure it was for their family or loved ones, you know, that they're happy also with how you cared for their loved one. And you have to kind of not take it too much with you when you go home because you're going to see it a lot. Even not palliative care nurses, just nurses on a ward. Yeah. You know, they look after dying patients. They have patients die on them on their shift as well. So it's not only palliative care. All nurses experience it. So,
and I think it's important what you said before, that you take off the load of those things that let's say with your grandmother, that the nurse took care of them, and then you spent the quality time and you could spend those last moments with that person. Those quality last moments. Let me just turn this. No, it's fine. Say
it's that. Even and I was young, I think I was maybe 10, but even I only recently found out that my grandma had a stoma bag. She had pancreatic cancer. I had no idea because the district nurses and the carer were taking care of all of that. That wasn't even
a concern for you.
Yeah, I don't even remember ever. My mum mentioned it the other day, and I was like, "What?
Yeah,
really? I had no idea." So yeah, just our aim is to just take care of them the best we can, and let the family and loved ones spend that quality time with them.
Practically, how do you prevent you becoming compassion fatigue? That's what I want to go into now. In order to do this, you have to show a genuine interest in the other person, and he feels that when you're not interested in him, he feels that. How do you prevent becoming, because of the work you just said before, 12-hour shifts? How many times is that a week? by the way?
3 or 4, depending.
3 or 4 times a week?
Depending on your rota.
Okay.
Yeah.
Okay,
3 or
inappropriate
4.
question. How much do nurses get paid in the NHS?
When you start out,
Mm-hmm.
so straight out of uni, I was getting about 1,500 a month.
Mm-hmm.
And then it increases every year slightly. You do kind of a review with your manager. And if you've met all your goals and done all your online learning that you have to do, or at least this is how they do it at my
Yeah.
trust, then it goes up slightly. But since starting the palliative care job, you come out as a band 5, you finish uni as a band 5.
Yeah.
I'm now a band 6, and I was getting about 22,100 a month.
Okay.
I think if you go really high up, you can become a band 8, which is like a site manager, and they kind of oversee the whole hospital, the beds. I think they get like 70 grand a year or something.
Okay. And do they have different names? How would the doctor or how would in a team would address them? Let's say.
You start. So band 5, which is what you come out at from uni, that's just a staff nurse.
Okay.
Then you've got junior sister, which is a band 6, or a clinical nurse specialist. They're also band 6. And you can be a band 7 nurse specialist. Okay. Or if you're on a ward, a band 7 is the ward sister. Band 8, I think, is the matron. And then up from there, it just gets more kind of managerial. Site manager, yeah.
Would you like to get into the managerial stuff? Or would you want to stay with the patient side of it?
Yeah, I think I didn't want to progress on a ward. I didn't want to be a junior sister and then a sister.
Yeah.
I wanted to do palliative care and kind of progress up that way. Mm-hmm. Which is why I didn't. I mean, also I think if you have that passion for being a manager, then the ward is maybe more the way to go up.
Yeah.
But I'm not very good at telling people what to do, so I will go the other way. And I had a more specialised passion that there isn't a palliative ward. So that's why I went that way.
Okay.
Yeah.
In order to be a good nurse, what qualities should a good nurse have?
Well, I think you have to have compassion, 100%. Mm-hmm. You have to care. You have to love what you do because it is tiring. You're not always thanked. And if you don't enjoy it, then you'll just burn out. Mm-hmm. You have to be good at communicating with others because you work in a team and it really doesn't work if you don't work as a whole team with your other nurses, with the doctors, with the physios, with the occupational therapists, even with the kind of admin, the ward clerk, who, if you don't have good communication with everyone, it just doesn't function. You can't. It's not a one-man show. You can't do it on your own. To provide the best care, you have to all work together. You have to like people. Because you're going to meet a lot of different type of people.
Be able to oversee their not strong points.
Yeah. Be patient. Yeah. You have to be somewhat organized because you'll have a lot to do and you have to be able to prioritize your time. But that comes with practice and with time and having good mentors. And if you're struggling, being open and talking to your colleagues about it. Don't be proud because that's when mistakes are made.
We get told this as well. One of the things we got told in first year, which was, I love this. It was, they told us your best friends in the hospital would be the nurses. And especially when you're foundation year, they know so much stuff.
Yeah.
Because it's what they do. And like you said, they're specialized nurses.
Yeah.
And don't think that you know more than them.
I witnessed that a lot of times. Not myself, I'm not that, but with the junior sisters or even the nurses that had been on that ward for years and years, and the F1s would come on and on the surgical ward, and they wouldn't really know, they weren't sure what to do, they were a bit nervous because the consultants were a bit mean, and and they would just say, okay, this is what you need to do, you need to write up this for them, you need to prescribe this is kind of the basics of what's prescribed for these kind of patients. And there was a couple times where there was junior doctors who were so arrogant, and it was so you could see the battle between the really experienced nurses and them.
Yeah.
They felt they knew more just because
they came out of medical school.
Yeah.
And
they
you're
didn't
a nurse.
listen.
Yeah.
And then
That's something that I want to highlight here, that this arrogance leads to mistakes. And when you think you know, and yes, ask.
Yeah.
When you don't know something, ask. You have to be a bit humble to.
Definitely. Even as the nurses, we have to be humble, because then if you're an experienced nurse, you shouldn't then think, oh, I'll know more than these doctors. Ask,
exactly.
Because they've had training, they've learned stuff that we wouldn't have learned.
And it comes back to what you said. It's a team.
Yeah.
If you go solo, you probably hit a brick wall.
Yeah.
There's this thing I like. If you want to go alone, if you want to go fast, go alone. If you want to go far, go together. I like that quote.
Yeah, that's good. That's a good quote. It's true.
But yeah. Let's move on to something else.
Okay.
I want to ask, when you're working in a team, how are doctors and other healthcare professionals, healthcare assistants, are they respectful towards each other, and is there a respect towards the nursing profession?
I think there, on the whole, I think there is. We do kind of, on some of the wards I've been on, we do board rounds, which would be the nurse in charge with the physio, with one of the doctors, with the occupational health, with the dietitian, and with the discharge team, and they would go through every patient on the ward, and as a whole team they'll say, okay, where is this patient at, what does this patient need, okay, who's responsible to help them with that, and that's just the team. And then that member that's been there will feed back to the rest of their team. So the nurse in charge who was there would come and tell the rest of us, or the nurse looking after that patient that day, okay, from the ward round, this is what was said and this is what needs to be done. And then the doctor will go and tell his team, the physio will tell their team.
Yeah.
So there is a respect, as in they do appreciate the nurses being there, and they do expect a nurse to be there, because nurses are the ones that are with the patient, and healthcare assistants. Healthcare assistants are amazing.
Yeah.
And I think they're often forgotten a lot. They are the ones that are always with the patient the whole shift.
Yeah.
And sometimes the most frustrating things that patients will do is they'll say things to us or the healthcare assistants.
Yeah.
And then we say, okay, to ask the doctor when they come. It's something for the doctor to answer to, or that they can solve it for them, we can't. And the doctor comes and there's a massive group of them, the consultant with the juniors and everyone, and they forget, or they're nervous because there's a lot of people. And then we say, oh, after, did you ask them? What did they say? And they say, oh, I forgot. Oh, I didn't ask. So nurses can then highlight that to the doctors. We can say, oh, so-and-so was wondering about this or wondering about that. So, I mean, it is a team effort. And I think nurses are respected on the whole by the majority of
the truth is that doctors can't do what they do without the nurses. Yeah. And nurses can't do what they both rely on each other. Yeah. That's what it means to be a team.
Yeah. Exactly.
Yeah. Have there been any I'm gonna dig a bit deeper now. Times where you've witnessed doctors being disrespectful to
nurses
or to healthcare profession? And I also wanted to ask, what's the difference between a healthcare assistant, a healthcare assistant and a nurse? What's the difference?
So the difference between a healthcare assistant and a nurse, I always describe it as like a teacher and a teaching assistant. So basically, so a nurse on a shift will get handover. You do your morning medications. You maybe help with washing the patients if they need that. If they're going to surgery, you do their theatre checklist. If they need dressings changing, you do their dressings. On medical wards, I think it's more heavier on the side of kind of personal care washing, things like that. Sometimes they might be going for scans. You need to call to find out the time. There might be things you need to chase up if they're going home and equipment's being ordered. You call to find out, has this gone in? Things like that. Also, and then the doctors do their ward rounds in the morning, and they'll give you a list of things that each patient needs doing. Healthcare assistants, so they don't do medication.
Yeah.
Really,
Okay.
I think that's kind of the biggest difference. They don't do medication, and maybe they don't chase up as much with, social things about going home and things like that.
Yeah.
But they help with personal care. They sometimes do chase up social, kind of
Yeah.
speaking to other healthcare professionals. They're the ones who I think spend most time with the patients. And I think they're often I've seen kind of doctors or physios not be disrespectful is in what they say to them,
Yeah.
but kind of thinking, oh, they'll sort that out. They'll clean that up. Even if it's a simple thing of, they've examined the patient
Yeah.
and they've moved all the bed sheets and the patient has their gown up, and then they'll just move on to the next patient, and that
Yeah.
patient's there with their gown up, with their bed sheets all over the place, and they just think, oh, they'll sort that out. And it probably seems like a small thing, but for that patient lying there, a bit exposed,
Yeah.
and it's nerve-wracking.
Maybe that's the reason why they don't tell the
Yeah,
doctors.
they're a bit like, so healthcare assistants do all the little in-between things, but that mean the most to the patients, I think.
Yeah.
And so I think patients tell things more to nurses than they do to doctors, and I think they tell things more to healthcare assistants than they do to nurses sometimes.
Okay. This is interesting. This is
Yeah.
very interesting. It's like the bond that the patient has is stronger
Yeah,
with nurses and healthcare assistants.
because they see
the
them the
doctor.
whole shift. And
Exactly.
often if say you've got 3 shifts a week, you might do them Monday, Tuesday, Thursday.
Mhm.
So you've seen that patient for quite a few days next to each other, and you often have the same patients for continuity. So that's not a new nurse every shift, and they just think, oh gosh, I don't know
Yeah.
this person. And so you do form a bond sometimes with them, so they feel comfortable to share things with you.
And I think the example you said before with the, like such a small thing, just like putting the gown down after you finish with the examination, it makes such a big difference.
Yeah.
Like these small things, these small details, because they're an act of compassion.
Yeah.
It's what you said before. It's not only any healthcare professional needs to
Yeah.
be compassionate. And it's these small acts of kindness, maybe a touch on the shoulder.
Yeah. Yeah.
And
No, it's
asking, are you okay? How you been this morning? I don't
Yeah.
know. I'm sure they do it, but
Yeah. On my previous ward, the HIV oncology ward,
yeah.
I think that's the best I've seen doctors and nurses and healthcare assistants and physios all working together. It was very tight.
Yeah.
Not tight as in, socially they went out, but tight as in everyone worked very well together. And patients respected them all as a team. And if the healthcare assistant would ask the doctor to do something, or they would say, can you go and see that patient? The doctors would listen to them because they know that they've worked there a long time. They know about these things. They've learned while being on the ward.
Yeah.
So that was nice seeing that. And it made you enjoy going to work because you felt respected.
This is, yeah, exactly. And it's what you said before. If you enjoy going to work, you're going to perform better. You're going to be a better nurse. You're going to be a better healthcare assistant.
Yeah.
If the people where you work for make that place a living hell for you,
Yeah.
you're not going to want to go there. And when you're going to go there, you're going to give the worst, you're going to show the worst part of yourself.
Yeah. Because it's demanding. And if you don't feel good, then...
And it might not even be your fault. It's just the environment.
Yeah.
I don't know. Sometimes when that environment it's built into a place, it's so hard getting out of it. I've seen this with the army. Because it's like you go to some places and the previous people that were there, they had this attitude. Right. And that attitude moves on to the other people that are gonna come up into it's not everywhere in the army, but I've just been to some places and I was like, okay, and this has a knock-on effect to the soldiers as well, and I'm sure this has a knock-on effect on the patients and the way the patients treat afterwards you and the doctors when they see doctors and etc. It's like a hierarchy. It just goes down and then it comes back.
No, it's true, because they'll appreciate. I think patients, if they see the doctors respect the nurses and the healthcare assistants, and you all work well in a team, they feel more confident in the care they're receiving, because they know if they've told you something, everyone will be on the same page. You have to all be on the same page. Otherwise it just doesn't work.
It's what you said, effective communication.
Yeah.
You could go. It's okay. We can cut it
sure?
out. Yeah. Go.
Let me.
Okay. So after a short break, we're back at it again. So we talked about the relationship between healthcare professionals, nurses, healthcare assistants. Let's go into the relationship between patients and nurses. How do they treat you? How do you sometimes have to be like strict with them? No, this is your
Some patients can be a bit cheeky. They don't really want to listen, especially if they think you don't really know what you're talking about. Sometimes they don't want to listen to us. They want to hear it from the doctor.
Even if you say the same thing.
Yeah. But most of the experiences of that I've had, the doctors have been very good in saying, listen to the nurses. They know what they're talking about.
Yeah.
But the majority of patients are amazing. It's only a few that sometimes. I think I've only had one patient that I had to just leave the room because he was getting really aggressive, not physically, but in the way he had come. So he was a frequent flyer on our ward. He often came, left, you know.
Like they say with British Airways.
Yeah. And he came, he was admitted quite late on a shift and all the doctors had gone home and it was just the F1 overnight, who really is just there to deal with emergencies. They're not there to, prescribe everyday medication because they don't know the patient that well. That's for the day team to do, So he came and he's normally on pregabalin and he pressed his buzzer. He wanted his pregabalin. Okay, I checked his drug chart. I went and got him what was prescribed. Gave it to him and he was saying, no, this isn't the right dose. And I was explaining to him, this is what's prescribed. I can only give what is prescribed, The day team can come tomorrow and review it. And he was getting so angry that I wasn't giving. He was saying he was on a higher dose than that. And I was saying, I can't just give you whatever you're saying to me. This is what's prescribed. Unfortunately, this is all I can give you, but I'll definitely hand it over for the day team to address. And anyway, he wasn't having it and he was getting really angry with me. And I just said, look, this is all I can do. I'm really sorry, but this is it. This is all I can give you. I will get in so much trouble if I just give you what you're saying. How can I, justify that? So I just left because it wasn't getting anywhere. I could feel myself getting angry and I didn't want to say anything. That's the point
where you step back.
Yeah. So I left and I spoke to my nurse in charge about it. And I just documented about it. And that was the only kind of experience that sticks out in my mind when a patient's started to become quite disrespectful and they just don't listen and they don't care what you're saying. Or one other thing, one bit of advice for when you graduate is on ward rounds. If a patient's going home and then the doctor will say, I'm going to write up your discharge letter. I'll do it right now for you. I'll do it in 5 minutes. But obviously they're not going to do it in 5 minutes because they've got 20 other patients on the ward round and then they'll have more pressing jobs. But then the patient just thinks they're going to do it now. So they'll come to you. Have they done it yet? Have they done it yet? Why are you taking so long? Why can't I go home? They've done my letter. And we have to say, no, it's not actually done yet. We call the doctors, can you do their discharge letter? And obviously they've got other things to be doing. They're not putting it off just to be annoying. But because they said to the patient, I will do it now or I'll do it this
as
morning.
Soon as possible,
they just hang on to that because for them, that's all that's going on for them. They're just waiting to go home. And they don't want to listen to us that it's not done. They don't believe us. They think we want to just keep them there for the fun of it.
Just keep them there.
So sometimes it's a bit frustrating, but on the whole, patients know, you're doing everything you can and they're really lovely. And I really love old patients because they're so sweet. They're really cute. So we often would have a patient that we've all got a bit of a soft spot for because they're just really cute. But on the majority, they're nice. They're nice to us, which is good.
Before I went to medical school, I went to I used to do a placement. We used to go and help out at a geriatric center. old people's home.
Yeah,
That's
okay.
not geriatric
Yeah.
center. Old people's home.
Yeah.
And old people are so sweet.
Yeah.
They got so much to say.
Yeah.
Stories and keep going and going.
Yeah, they're funny, and it's quite cute when you see patients make friends with each other in a bay.
Does that happen oftenly?
I love it. Yeah, it's really cute, and they'll go and sit by each other's beds, and they'll talk, and they'll help each other out.
Oh,
yeah, it just warms my heart. I love it.
Exactly, that's heartwarming.
It's really cute.
Let's talk about the misconceptions. Let's list them up, and then we could go over them.
Hit me.
So, nurses don't get paid well.
I mean, for what you do and the hours, probably not. But I think that's with all. I mean, it's not awful. You can live on it. Yeah. A lot of my I'm quite fortunate that I live at home. But a lot of my colleagues who are renting, they had to pick up extra shifts to be able to pay rent and bills and obviously live and have a life. But it does pay. There's jobs that pay worse.
Yeah.
But I think everyone in the healthcare profession probably feel that way because you give so much of your time and your energy. But it's not awful.
Yeah.
Yeah.
That's what you said.
And as you work your way up, it can increase.
Gets better.
Yeah.
Yeah. The more there's perspective in the job that you keep getting better at what you do. You get paid more.
Yeah.
Well, you've debunked this already. All nurses are the same. No. You've listed.
I think with everything there's good and bad. So some of the other nurses who are kind of similar in my age, I just think they're so different in the way they approach patients. You know, some have kind of more banter, some are quite strict, some are more friendly, some don't like to get that personal with patients, but patients respect all the different approaches and characters. There's some nurses that aren't that great, but most are good.
Yeah. It's the same with every profession.
Yeah.
Exactly. This I've got here one that says nursing is just grunt work. Do you want to take a hit on that?
Yeah. Well, I assume they mean it's just not important stuff that the nurses do, and it's just, but that's not true. I mean, like you said before, it couldn't function without nurses.
Exactly.
I mean, I'm probably a bit biased, but the nurses are probably like the glue that brings all the team together because they're the ones that know the patients best. So they're their advocate with all the other healthcare professionals. Without them, I mean, who would be looking after them with the healthcare assistants for the 12-hour shift? You know, the doctors pop in, pop out, physios pop in, pop out. It's not grunt work.
I like that.
The foundation, I think.
Nurses are the glue that brings patients and healthcare professionals together.
I think so.
I'm writing that down. Let's go to an Instagram post.
Amazing.
There's another one here that says nurses are less intelligent and skilled than doctors.
I mean, obviously doctors, their course is more intense. It's longer. They come out qualified higher up in the hierarchy of the hospital, so you can't say they're the same. But in some respects, nurses probably are a bit more qualified, especially ones that have been in one area for years. You know, the doctors look to the nurses. Sometimes the junior doctors look to the nurses for guidance, for help. So no, I wouldn't say they're less intelligent. Just they're as intelligent, but in other aspects. Exactly. I mean, I had to sign off junior doctors. Nurses, we sign off junior doctors on some competencies. So if we're less intelligent, I don't think we do. It's quite good.
That. Yeah.
It's quite nice being asked by a doctor to sign them off.
It's like,
I'll think about it.
That's nice. So I think that's all of the misconceptions I have here. Let's go to some more personal questions. How is it being a mother and a healthcare professional?
So my daughter's 10 months old, so I'm still new, still on maternity leave.
Yeah.
work have been amazing with maternity leave. I've asked to take a whole year off and they've been so accommodating. And I only just started my new role in palliative care. I was there for about 3 months and now I've been on maternity leave. But they've already been so amazing. My manager texts me every now and then to check I'm doing okay. So far it's been great. I'm looking forward to going back. I have missed it.
Yeah.
So we'll see. I'm going to go back part-time. And again, they were so accommodating with me doing that.
Yeah.
So we'll see how it goes when I go back. But I'm looking forward to it.
It's good. In the UK, they're really accommodating in this sense. With they give you a whole year off.
Yeah.
And I'm guessing you get paid during that.
Not the whole year.
Not the whole year.
It's a few months full pay, a few months half pay, and then it's maternity pay. And then I think the last 2 months or so is unpaid.
Okay.
So it depends on your situation, if you can afford to take the whole time off.
Yeah.
Luckily, I'm in a situation where I can. So yeah, I thought, why not? Yeah.
No, it's good. It's very important. It's very important for the kids as well.
Yeah.
Like to be with them. It's point period. What are you most thankful for?
I think most thankful for my family and my husband, because they've really helped me. I had kind of times where I was dreading going to work. I was tired. I knew it was going to be a long day. I knew the patients maybe weren't the easiest, but they would take me to work, pick me up, bring me home. And even though that's a small thing, that was so nice to just not have to
Get on the tube.
Yeah, not get on the tube, not get on the bus, just sit in a warm car. And so they're everything. Yeah.
It's a thing to look forward to as well.
Yeah.
I find it heartbreaking when I see people that they finish work and then they don't want to go back home because what waits for them back home is worse than what they were.
Yeah.
But yeah.
You need good people around you.
Surround yourself with good people. And it's not just, I think things like this don't just come and find you. Like you can make most of this happen.
Yeah.
Of course, you might not start off with the best friends or with supportive family, but you surround yourself with the people that you want to.
It's true. It's true.
Who do you admire?
I don't know, I was thinking about this. I think from different nurses I've worked with, especially nurses around my age, because I think who are amazing. And I just think they're doing that. I can do that too. It pushes me, and I admire how hardworking they are, how knowledgeable they are. And I think I should be like, I shouldn't slack. I should be like that too. So yeah, just colleagues really. Yeah. Who push me to do better. Yeah.
That's amazing. What about give me a favorite movie that you have?
Oh, I love Disney. Yeah, I'm a bit of a kid. Anything Disney.
Anything Disney.
Moana. Yeah, I like that one.
You know what? It's quite embarrassing, but I quite like Disney as well.
Yeah,
I went to the cinema and watched Moana with my little sister.
Yeah.
Yeah.
I cried like 3 times.
But yeah, I don't know. It's we all have a kid inside. And I was speaking to the psychologist. He probably he still reads comics.
Yeah.
Like Scrooge Donald Duck. But
yeah, Disney. Anything Disney.
What about a book?
Books. I like Jodie Picoult. She does kind of like morally controversial books, like My Sister's Keeper. About.
I've heard about this before, but I don't know what it is about.
So it's a family who have a daughter who's really unwell, and they have another daughter, but they do kind of genetic. They make the second daughter basically just so that she can help the first daughter, the eldest daughter, and then with kind of bone marrow transplants, things like this. And as the second daughter gets older, she doesn't want to do it anymore. She wants her own independence, and it's like a court. There's always a big court case in her books, and it's always like this moral dilemma. I liked books like that. Now I don't really read as much.
You don't have the time.
Don't have the time.
You need sleep.
Yeah. It's crucial.
But yeah, okay, let's go to the last question.
Okay.
What's the advice you'd give to a younger nurse
Mm.
who's studying now or an aspiring healthcare professional? I think let's split this in two.
Okay.
To a younger nurse and to a
Okay.
younger doctor. Let's say a
Okay.
medical student. Let's
Yeah.
split it in two.
Okay.
Yeah.
A younger nurse, I would say research into, because there's adult, child, mental health, learning disability. Make sure you know which one kind of appeals to you most. Make sure you really love it. They say most nurses drop out in the first year of uni because that's when they kind of realise,
They don't want
this is what it is. Yeah.
Yeah.
So if you don't love it, you don't force yourself to do it because it is demanding. But just, if you love it, just go for it. And have good friends, good family around you that you can talk to, because you all have tough days, hard days. So you need to have an outlet.
Yeah.
But yeah,
That's
it's
your
great.
pit stop. Surround
Yeah.
yourself with good people.
Yeah.
Yeah. That's a good message.
And for young doctors, well, I guess just be open, to the whole team. Don't be arrogant, which I think the majority aren't like that. There's probably a few that have ruined it for
the rest. It's this thing that we do, like we see something bad. I do it a lot, and it's like we pinpoint. It's like, oh look, all of them are like this because he's like that or she's like that.
But it's not the case. Yeah,
but that's not the case. And because we do this, we forget to be thankful for all the rest of the good people that are out there in the world. For all the rest of the
Yeah. So just do you be good. Help people. It's an amazing thing to do. So, and you'll help so many people. So, be proud of yourself.
That's a great note to finish on.
Yeah.
Thank you so much for doing this. I've really enjoyed it.
Me too. It's been good.
I'm glad, and I know it's difficult to find time now.
No.
So again, it's like a double thank you for being here and doing this with me. Okay.
Thanks for asking me.
All the best. Bye-bye.
Bye.